analyzing the data helps us to improve our clinical pathways, improve the way we work, and even predict outcomes. Remember that you became a nurse, you became a physician, you became a cardiologist to serve the patient.
Welcome to yet again episode of the Science Capsule. In this series of podcasts, you will be able to meet world-leading researchers, academicians, and those who are able to generate some impact in the overall community. The Science Capsule will increase the visibility of innovation and science. It will also going to foster interaction between the experts and the young budding scientists. Today, in this series of podcast, we have an eminent and leader in the industry. Rather, I must say that he has created the industry in Pakistan at least. Expert in digital health, mobile health, e-health, and leadership in medicine. Dr. Zakiuddin Ahmed. A very quick, brief intro, and would like him to speak more about himself. He is a medical doctor and a business graduate. He is also certified professional in entrepreneurship from MIT Boston, adjunct professor, digital health, Health Services Academy, Pakistan, president of Healthcare Quality and Safety Association of Pakistan. He's also a project director at REFA Institute of Healthcare, Innovation and Safety at REFA International University, General Secretary of Health Research Advisory Board, and many other things. I have a very long list. Let's meet Dr. Zaki Ahmed. Hello, sir. How are you? It's a pleasure to meet you, sir, today.
Thank you very much. Bismillahirrahmanirrahim. Assalamu alaikum. It's my pleasure to be here.
So this is a long list. What's happening? You are a busy man.
Yeah, I'm a busy man, but I like that busyness. You're right, and thank you very much for the introduction. I work in all.
Did I leave anything, or you want to explain your thoughts?
Don't get me started.
But okay. Okay.
Yeah, but essentially, these are the areas I work in, and I'm a physician by training. I don't practice anymore.
All right.
Because I realized at the outset that the healthcare system needs to be improved, and some of us should work in this space. And I was fortunate to come across this concept of telemedicine very early on in my career.
All right.
So, alhamdulillah, I decided that it's going to be my calling for the rest of my life.
All right.
And since this was aligned with my mission statement, which I was able to create and craft very early on.
You have your own mission statement.
Yeah, professional mission statement
very
is
okay.
So it's a very simple professional mission statement, and it says that I want to improve the healthcare system of Pakistan.
All right.
Because that's my circle of influence.
Right.
Although I do work globally as well, but I'm focused more on improving health system in Pakistan, definitely. Okay. So yeah, telemedicine was my first area, and I started telemedicine around 25 years ago in Pakistan, and ever since I've been involved. So that's my first love, if I may use that word.
All right.
Still going strong. So now we call it digital health.
Okay.
So digital health or telemedicine is what keeps me busy, essentially. but there are other areas, as you mentioned in your introduction.
Yeah.
Thank you, thank you for doing that. My second area is patient safety and quality healthcare.
All right.
The third area which I work in is health research, and the fourth is healthcare leadership. So I move between all of these four areas with different responsibilities. Obviously, some leading positions I have, as you mentioned.
Yeah.
But essentially, what I do is every day when I wake up, I divide my time and around these four areas.
All right. Tell me a little more about ILM, for which you have also founded that institute. So the audience really like to know leadership in medicine innovation. What it's all about, please.
I think I would like to mention something here. I think Pakistan needs more institutions,
Yeah.
and as opposed to individuals.
Okay.
So, and I realize this, and whatever I have done, or most of the things I've done, is that they're beyond me as a person, and hence, when I started working in healthcare leadership, I immediately decided that it needs to be beyond Dr. Zaki.
Okay.
And hence I established this institute, which is inshallah going to be there even when I'm not here.
All right.
But this institute will be here.
The
So
legacy will continue. This is what
hopefully, inshallah, and by that time I would have developed master trainers, and the ecosystem
Yeah.
of healthcare leaders would also have been developed by that time, hopefully, inshallah.
Okay.
So this is the Institute of Innovation Leadership in Medicine, and we call it ILM.
All right.
ILM
Very
stands for
interesting name.
knowledge.
Yeah, knowledge, yes.
Alhamdulillah. And in this, under this institute, and as a certified trainer of 7 Habits, Unconscious Bias, and some other areas, we have developed some programs. So these are one-off certificate programs as well as longitudinal 1 year, 6 months program on healthcare leadership, healthcare communication, compassion, and other areas which are linked or aligned to the 21st century physician, which we are aiming to develop in Pakistan.
Fantastic. So a very diverse, little bit of diverse work, and you're joining it together as Dr. Zaki has joined it together. So how this has happened?
It seems diverse, but it converges
Really?
on one point.
Okay.
And what that one point is, I've already mentioned. So I think once you have figured out the why of your life,
Yeah.
whether it's professional or personal, and obviously there's an overlap between the two. So Alhamdulillah, I think I was blessed that I was able to figure out the why of being a physician. And I entered into the space. I come from a family of engineers. My father, my brothers, uncle, pretty much everyone was an engineer. I was the youngest in my family. And Alhamdulillah, I had the realization at that time that I want to work in healthcare and serve Pakistan. So with that, why behind me, I developed this mission statement, and which is basically centered around patients.
All right.
And this is what I help my physicians, my colleagues to understand, even medical students, that we all exist only for one thing, which is patient. We exist to serve them.
Yeah.
Period. That's the raison d'être, if you may,
Yeah.
use that
Yeah.
term. So our raison d'être is that we exist to serve the patient. So once you have figured that out,
Yeah.
then all of these areas, so digital health, patient safety, health research,
Yeah.
and healthcare leadership,
Yeah.
all of these actually help me to achieve my ultimate objective or my ultimate purpose, which is to create or develop or improve the healthcare
environment,
ecosystem in Pakistan and globally, inshallah.
Okay. Let's go back a little bit, and for the audience who are not fully aware, what are the key differences between e-health, telemedicine, teleconsultation, and mobile health? To me, it looks all the same. So, are there any differences? Because you're the expert here. Who could be the better judge and explain this entire thing?
There are some differences.
Really?
But I'll share the history. So this started as telemedicine. So telemedicine was the first term which we used to, use. Hence the American Telemedicine Association. So I was the first Pakistani member of American Telemedicine Association, and I was part of this conversation which started that ATA wanted to move from telemedicine to telehealth, which was coming up. So a new term was coming up. But then ATA decided that no, telemedicine is something which we would like to keep. At that time, WHO was not very active in this space. But then when WHO got involved, so WHO came up with this universal term, which we used to call at that time e-health.
E-health.
And WHO, kind of recommended that everyone used that term. So the International Association of E-Health and Telemedicine emerged, which used the word e-health. And that's a federation globally. And e-health technically included telemedicine, included m-health, health informatics, the EMR and the hospital information systems.
Okay.
So all of those came under this umbrella term, which is e-health.
M-health is mobile health?
Mobile health.
Mobile health, okay.
So at that time, the mobiles, started coming up very, it was a very
quickly
fast,
adapted by the people,
So as soon as mobiles came, so the mobile companies, came into this space that, okay, they wanted to use mobiles in healthcare. And that's where, M-Health came. So these medical call centers, so we started the first medical call center in Pakistan, partnering with Telenor around 14 years ago, under which the mobile users could just pick up the phone and call a doctor 24/7. So that's mobile health or M-Health. But M-Health also technically came under e-health. And hence WHO came up with a national toolkit for all the countries part of WHO to develop their national strategy on e-health. And alhamdulillah, I was one of the 3 international consultants who developed that e-health toolkit.
Fantastic.
But the migration again took place. So we didn't stop there.
Really?
Then came, a few more areas or ideas or concepts. So remote patient monitoring and then devices, which we were able to connect to our softwares. And hence a very comprehensive overarching term developed, which is now accepted by the WHO and globally as well by people who work in the space. And now we use one word or one term, which is digital health.
Digital health.
So that's the journey from telemedicine to digital health as we use now.
Great. So digital health is now incorporating all the elements into this related to patients, physicians, hospitals.
Whatever you're doing in healthcare, health and IT. So it's a marriage between health and IT, right?
Interesting.
So whether it's EMR, electronic medical record, whether it's patient portals, physician portals, anything related to healthcare and using technology will be covered under this term now. And WHO is also using this term. So the National E-Health Policy Toolkit, which WHO developed, now we are now using digital health.
Digital health.
So digital health is kind of replaced e-health.
And what about wearables and ocular glasses? Are they also a part of this entire digital health?
Yeah. So these actually a very good point, because these are the recent game changers. So these come under the connected health / remote patient monitoring area. And so I was the director of digital health at King Saud University for around 6 years.
Really?
And there, alhamdulillah, we developed the world's first of its kind, completely integrated, connected health platform. Through which we kept the patients connected to the hospital, physicians, nurses, 24/7, wherever the patients were. And all of that was done through those wearables, the devices which you mentioned. So today, we can measure pretty much we can get every information of a patient through those wearables / devices, wherever those patients are. And those devices are connected to a software, if you can, in easy terms, and that's connected health or remote patient monitoring.
Right. What about bioinformatics, that is, or data that has been generated from these electronic health? Did it really improve the efficiency or at work of a healthcare system, or reduces the cost? Do we able to collect the benefits of the digital health?
So this space is actually maturing. We have some evidence, but obviously since this is a new space,
Yep.
so we don't have a 10-year study or a 20-year study. But there's recent evidence
Yep.
which has shown. So even when telemedicine started many years ago,
Yep.
even at that time we had evidence that even the patients, there were more than 90% of the patients 30 years ago
Yeah.
wanted telemedicine or teleconsultation
Yeah.
because it helped them. It saved time for them. It saved the issues related to traveling, etc., etc. So having data, and today data is gold,
Yes.
and data is king.
Yeah.
So analyzing the data helps us to improve our clinical pathways, improve the way we work,
Yeah.
and even predict
Yeah.
outcomes. So there are some softwares like Clinical Decision Support System (CDSS),
Yes.
through which physicians can not only make better diagnosis, because diagnostic errors account for 25% of the preventable medical errors. So it's a huge number. So physicians using those softwares of CDSS, they can not only make better diagnosis, but they can also actually educate their patients, educate their residents, and then through the data analytics, they can predict the outcomes of their patients.
All right. So, what's space here in Pakistan? Are we moving ahead with it? You see roadblocks. You see good development of digital health in Pakistan. What? Since you are the expert, we want to listen from you.
Okay. So yeah, so this is a sensitive area. So I will start with the positive side.
All right.
So in the last 5 years, I would say, I think we have seen a good growth and uptake of digital health, and obviously COVID helped.
Yeah. Okay.
So this
That's the only place COVID helped, I think.
yeah, COVID really helped, not even only in Pakistan but globally as well.
Globally, yes.
So even in the US, the regulations which were stringent before COVID were relaxed by executive orders of the president.
Yeah.
UAE started doing telemedicine immediately. So definitely COVID helped the digital health space or telemedicine. So in the last 5-6 years, I would say that the uptake has started. But unfortunately, if you compare Pakistan with other countries, and I'm not talking about the developed world, not the US or UK's, but
Same
India
level, low
or
income.
Saudi Arabia,
Yeah.
I think we are still behind. And one of the reasons is that the government or the Ministry of Health has not really taken digital health in the last 20-25 years very seriously. And since we don't have any national policy or a strategy, which countries like Saudi Arabia have, they've had this strategy of e-health for more than 15 years now.
Okay.
So since Pakistan doesn't have that, so all the uptake has been led by the private sector,
Yeah.
individuals, physicians, or startups. So today, I think it's growing, and I'm very hopeful. But still, there are barriers, as you mentioned. Physicians need to understand that technology is here to help them improve their processes and the outcomes for patients. So a lot of work needs to be done, and I think we are still unfortunately behind India or even other regional countries.
Region including Bangladesh or Sri Lanka?
Yeah, Bangladesh has been very active in mHealth.
Yeah.
So even before we started the first medical call center, they had a medical call center.
Yeah.
They have a lot of mobile health applications.
Yeah.
So I think all of the countries need to do more and do better.
All right. Pakistan has one of the largest population where they have access to telephone and mobile. So I think that would be could be a way forward for this mHealth become very important. So
Exactly.
how this what's the research around this area? How this is being translated into benefits to the community, or the practice itself, or young researchers or young physicians who want to adapt their digital health concepts into their lives?
So the current, space actually revolves around startups. So the startups, and it's very encouraging, and I've been involved with pretty much, not all, but
Yeah.
most of them. I've mentored them, helped them in different ways, and we all support all the startups coming in this space, but they're still in the proof of concept stage, and then they're obviously getting funding. So we don't have business models in Pakistan, or very successful models. The business models are also starting, again, very encouraging, but we don't have established business models or financial success stories in terms of actual patients and revenues and sustainability in financial area. So we are still in those POC
Okay.
mode,
Okay.
and hence we don't have research, which is indigenous research,
Right.
which supports that, say, telemedicine or a mobile health application,
Yeah.
improved healthcare in this area. So these are smaller studies, observation studies, but I think we need to, again, like I said, we need to have better, more mature, trials done in this space, especially around devices and all the areas of digital health. So a lot needs to be done in this space.
Right. You just mentioned about COVID. I remember that during the COVID period, specifically in Pakistan and other countries as well, there was lack of space in the hospital. So many patients were actually managed at home as well. And this is where the digital health or impact of the home monitoring actually came. And also in Pakistan as well, a lot of patients were managed at home by their caregivers. Let's switch gears a bit. Let's talk more on
From my first love.
yeah, from your first love
Yeah.
as well. So, what's happening there
Second
now?
love.
Your second love. Interesting. Okay. So usually there is a love before the first love, and you do not know that's a love. That's another thing. So what's happening in your second area, love area?
So yeah. So second area is patient safety and quality healthcare, and this again has matured. So I'll just give you a little bit of background. So quality patient safety started around 23 years ago.
Yeah.
Formally, when this report came out by the Institute of Medicine in around 1999, and the title of the report was "To Err is Human." What this means is that as physicians, as nurses, pharmacists, healthcare professionals, we will make mistakes, and those mistakes will lead to preventable medical errors.
Yeah.
So this report actually said that around 100,000 patients die every year in the US because of preventable
errors.
medical errors.
Yeah. Yeah.
And as soon as this report came out, which was the first of its kind, obviously, it shook the whole healthcare system,
Yeah.
not only in the US, but all over the world.
All over the world.
And then we realized with more studies that it's not 100,000. So some of the studies said it's 250,000. The other study said it's 400,000. But the number kept going up. And then a very serious study came out from Johns Hopkins, and which said that the third leading cause of death in the US is preventable medical error. So it's not a disease. So the first is cardiac diseases, second is cancer, but the third is not a disease. It's
Errors.
the errors which happen in hospitals or healthcare facilities, because we are humans and we will make mistakes. So patient safety and quality healthcare revolves around that. And what we do, so alhamdulillah, again, we took lead in this space, and I remember I organized the first quality conference in Pakistan many years ago. I also organized the first telemedicine conference, alhamdulillah. So I'm really humbled and proud that I was able to contribute in this,
Amazing
in
work,
these
sir.
spaces.
Yeah.
And then we established the first dedicated institute, not only of Pakistan but of the region, at Rifa University,
University.
under the leadership of obviously our managing trustee and chancellor. This institute is called Rifa Institute of Healthcare Improvement and Safety.
And safety.
And this, and I'm the director. So we have a team, and since last 7-8 years, formally we have been working with WHO. We've been working actively with healthcare commissions and all these stakeholders, including major hospitals, to develop and improve the quality processes in hospitals.
Yeah.
Because patient safety and so our narrative in under quality and patient safety is as humans we will make mistakes.
Yeah.
But how do we prevent medical errors then?
Right.
So preventing medical errors only requires that we improve systems. So one example is a checklist. So a surgeon goes into the OR, and before he or she starts the operation,
Has a checklist to
he
follow.
or she has to have a checklist, just like a pilot in the plane.
Yes.
So these are small interventions and measures through which we can avoid wrong-sided surgery, wrong person surgery, etc., etc.
Yeah. Yeah.
So,
Agreed.
so we work on developing and improving systems, and alongside what we did was we started an international conference on patient safety. We call it ICPS. So, as the chairman of the conference, I'm leading this, and we organize it in every city.
Okay.
And our model is that one of the leading hospitals hosts the conference. So Aga Khan University hosted the conference, Liaquat National hosted our conference, Rawalpindi Medical University hosted our conference, CMH Lahore hosted our conference. So the last one was in Karachi, where we had around 26 international speakers, and the next one will be in Lahore, Islamabad. So we are building this space,
Yeah.
and Alhamdulillah, Pakistan also took a leadership role in developing a regional consortium
Very nice.
of patient safety, including 15 countries, which Alhamdulillah Pakistan is leading.
So it's great to see that a research transforming into policy decisioning and patient safety becoming very, very important element for the healthcare overall, the healthcare system. Now, gear number 3, your third love, what is it all about?
Yeah, so this is health research where you and I work together.
Yeah, we work together.
And we are really thankful to you and your colleagues and your organization for supporting us. So again, keeping the focus on the health system of Pakistan. So that is always our concern. Okay. So we have laser focus on just one thing:
changing, updating the health system. That's the main focus.
How can we improve healthcare in Pakistan?
Okay.
With a patient-centric focus. Yeah. So that's what we want to do.
And you're talking about as a General Secretary of Health Research Advisory Board now, right?
So that's my responsibility.
That's your responsibility.
That's my responsibility.
So what's happening in that arena here?
So Health Research Advisory Board, again, an institute or an organization, was established around 10 years ago with a basic premise that some of us, we sat together, some leaders in healthcare, around 40, 45, and we all agreed after the realization. The realization is that Pakistan has been embarrassingly lagging behind in health research. We don't have local data which we can use to improve healthcare or to present in international conferences. So 10 years ago, all of us, got together and we decided that we need to have a national initiative or a national movement or an organization which will drive health research in Pakistan in order to develop and improve the health research ecosystem of the country. So that's how Health Rab was born. And in the last 10 years, with support like organizations like yourself, this is, by the way, a not-for-profit, duly registered organization.
Fantastic.
Our chairman is Professor Dr. Abdul Ghaffar Billu, who's a professor emeritus and who's perhaps the most respected healthcare leader and physician scientist in Pakistan. So he leads from the front as a chairman, and then obviously we have a board and we have charter members. So it's, I think our major contribution in the last 10 years, other than capacity building, so we have organized hundreds of workshops. We have developed the national research policy, which we have submitted to the government. But I think our major contribution, alhamdulillah, is that we developed national disease registries, which were not there before Health Rab. And we realized that we need data, and we not only need data from one institute, but we need data from a national level, from all the major cities and institutes and hospitals of Pakistan, so that we have data which we can present and use.
So within 10 years, how many registries you were able to do?
So alhamdulillah, we have more than 10 right now.
Wow, that's amazing.
And
one in a year, that's a lot.
No, we had a few at the outset. I think in the first few years we had 4. so which are still going strong.
Very nice.
So the first was the National Joint Registry,
Yeah.
which under which we have, I think, published 8 annual reports,
Wow.
which have been distributed all over the world. It started with 7 physicians or surgeons sharing
Okay.
their data.
Okay.
Now it has 140 plus surgeons sharing their data. So it's a very unique success story, not only for Pakistan but for to be used globally as well.
Yeah.
And Professor Dr. Shahid Noor leads that as the chairman of this committee, registry committee, and our founding board member. And then we have Diabetes Registry of Pakistan, led by
Yes.
Professor Dr. Abdul Basit.
Yes.
We have the Cardiology Registry of Pakistan, again led by our founding board member,
Yes.
Dr. Bashir Hanif.
Hanif.
We have 4 registries in the gynae ops space. We have one in pediatric orthopedics, one in spinal surgery, where we have collaborated with Eurospine. So, and we have data, and these are like 2 years old, 4 years old. With crop, we got a huge success when the Supreme Court of Pakistan, after taking a suo motu notice, mandated cath labs. All the cath labs now are becoming part of the Cardiology Registry of Pakistan. So I can actually go on and on with,
Yeah, I
alhamdulillah,
can.
the contribution of Health Rep.
Yeah.
But I think only one, which is our major one, is that we are developing national registries. And I think a few, we are
Yes.
now starting the
Yes.
psychiatry registry with
Yes.
your organization,
Yes, yes.
and hip registry,
Hip registry, hip
heart
fracture
failure
registry,
registry.
heart failure
So we are really excited.
You still feel that we are data deficient country in health related to health
I
parameters?
think we've done some good work
Yeah.
in the last 10 years.
Yeah.
But since we started from nothing.
Yeah.
So it's now we have data, especially in these 3-4 areas. But now we need to use that data. So we need to have translational research, as we
Right,
use
right.
that term.
Yes.
Right. So we need to translate that research, and we also need to implement. So implementation research and translational research are something which we are now aspiring for, and as we say, giving meaning to the data which we are getting through these registries.
So you had an event where Supreme Court intervened and took that register.
So I think that was a tipping point for us.
Yeah.
Although the Cardiology Registry of Pakistan was there for some years, and we were getting, I think we had around 20 hospitals which were giving us data. But as soon as the Supreme Court took the suo motu notice, now we have around 100.
Since it became a part of the
So,
law,
yeah, it really
many
helped us.
abide by the law, and they
And I think that all the directors of these registries,
Yeah.
I think they've done wonderful work. I think our registry is now connected with the American registry.
Yeah.
So good, good success stories, accolades, which Health Rep has contributed and facilitated in this space. We also do research awards. So one of our areas is to encourage young researchers,
young scientists, young budding scientists. You want
so
to
we
encourage
do
them.
that a lot.
Okay.
And
You also give grants to the through health
small
Rep?
grants.
Small grants.
Yeah, small grants, because we are also dependent upon grants.
Yeah.
So we have to be very efficient and judiciously use our resources. So most of our work is around collaboration, strategic collaboration, and coming up with these ideas under which we get more partners.
Yeah.
So now, alhamdulillah, Health Rep is becoming part of global initiatives.
Yeah.
So one is the Respire 2, which is started at the University of Edinburgh. And now we are, inshallah, reaching out to the Pakistani expat physicians community,
Yeah.
APNA in the US, APNI or APPS in UK,
Yeah.
and this huge resource of physicians in the Middle East.
Yeah.
So we are now showcasing to them what we have already achieved, alhamdulillah,
Yeah.
and what we want to achieve more in future with synergistic collaborations with them.
Agreed. Let's put gear number 4,
Yeah.
which is healthcare leadership. So now I'm connecting these dots. Previously I was not very clear. Now I'm connecting these dots. So what about the gear number 4, healthcare leadership?
Yeah. So a little bit of the background.
Yeah,
So when I started my journey in telemedicine 25 years ago, it was a very, very difficult journey. Just imagine, 25 years
25
younger
years ago.
Dr. Zaki,
Yeah.
right, talking about telemedicine in Pakistan. People did not take it, I'm using
Seriously?
I'm using words which are softer.
All right.
I'm not saying that they used to throw me out of their offices,
All right.
but strong resistance from physicians.
Okay.
And I think some of the points were true, because we have different challenges in Pakistan. So I do understand that. But I was obviously pushing telemedicine, which was a too good to be true concept, right? Especially for Pakistan. And that's what I realized, that 70% of our population lives in rural areas. And they're dying not because of cancer, they're dying because of lack of access to basic healthcare. And telemedicine was just a wonder, a magical way.
A quick access.
Just connect. And that's when we started the first project at Jinnah Hospital under the leadership of Professor Dr. Rashid Jumma, with the support and grant from Engro. We connected Jinnah Hospital, Karachi, which is a major tertiary care hospital, to Gambad and Shikarpur. So it was a hub and spoke telemedicine model, where we created a proof of concept. This was done around 18 years ago, sorry. And alhamdulillah, we continued this project for 5 years and connected 7 cities to Jinnah Hospital, and conducted thousands of teleconsultations, establishing the proof of concept that it works. I think that was needed. But going through that journey of introducing something new and asking physicians to change, asking healthcare regulators to change
the way of working,
and then again working in patient safety, which was again very difficult, because we were talking about preventable medical errors. We were using these statistics of WHO, that 1 out of 10 patients are harmed while in a hospital. So obviously hospitals and healthcare professionals were not comfortable. They were not comfortable. So what I learned, I think that was a learning, and I realized that in order for us in Pakistan, in order for us to utilize and to understand these concepts and utilize technology or other means efficiently and effectively, we need to develop ourselves in the area of healthcare leadership. And I was already conducting workshops on CANMADS, which is the physician competency framework by the Royal College of Physicians and Surgeons. It's a very respected framework. So I was already conducting workshops, and I was always a fan of 7 Habits. So the dots were getting connected. And with my experience of facing challenges, connecting with physicians, and obviously the ground realities which we have in Pakistan. So I decided that if we are to develop digital health or health research or patient safety or any other area in health research, in healthcare system, we need to develop our healthcare professionals, not only physicians, but nurses and pharmacists and other healthcare professionals in the area of leadership. And then, obviously, I did my homework and found that every country, every major hospital in the US or developed world, they have a mandated program on healthcare leadership. So NHS has a 9 modular program. Canada has the ScanMed. Harvard has their this program. Pretty much every leading organization or even the governments are teaching to their physicians and students healthcare leadership. So and again, as I said earlier, that I believe in institutionalizing things rather than individualized approach. So immediately developed an institute and started my focus more. So in the last 4 years, my focus has been more on helping healthcare leaders. So I've conducted these workshops and sessions for vice chancellors, for professors, for clinicians and nurses and pharmacists. Conducted these training workshops for the CEOs of all the government hospitals of Punjab. So helping them, and again, I'm not using the word training. I'm using the word helping my colleagues, my seniors, my juniors to understand how critical leadership is in healthcare
Yeah.
if we are to improve our health systems.
All right.
So it's not enough to be a good cardiologist or have skills of or surgical skills. That's that's a given that needs to be developed.
Yeah.
But a surgeon or a physician or a cardiologist needs to develop his or her communication skills, leadership skills.
Yes.
He or she needs to be more compassionate, more empathetic.
Yeah.
So I think that's an area where I've focused my energies, my efforts. It obviously is helping me to be a better person.
Yeah.
But I think that it's adding value.
I'm sure it is.
In the healthcare ecosystem.
Do we have gear number 5, or we do not have?
No, these are the 4. So
I
I focus.
There's no gear 5.
Yeah, I'm an entrepreneur.
Oh, okay.
I'm an entrepreneur, but that's not. That's something which is part of me. I've always been an entrepreneur. I started an organization which was already in the U.S., which is called Organization of Pakistani Entrepreneurs of North America, Open. So I started that in Pakistan as the founding president of Karachi. Then we started Open in Lahore. So now we have 3 chapters in Pakistan. It's the largest organization of Pakistani entrepreneurs.
Okay.
It doesn't have anything directly to do with healthcare.
Okay.
It's about entrepreneurship.
It's about entrepreneurship.
So that's an area, where I'm also involved. I do mentor startups, and again help my colleagues and my friends in the startup space.
Okay.
Yeah.
Okay. So, what Dr. Zakiuddin Ahmed would be without digital health?
See, I would like to say that my allegiance is not with digital health.
Okay.
My allegiance is with the patient.
Okay.
And as I use this this word and the term, and in all of my training sessions, my first slide or the third slide after my introduction is why do we exist? So I asked my colleagues, if I have an audience of 50, 60 professors or students, doesn't matter. I asked every time I ask them one question. The first question: why do you think you exist? Why do we exist as healthcare professionals? And the answer is just one: we all exist to serve the patient. Now that's the ultimate objective, to develop healthcare system in order to serve the patient. Digital health is a pathway towards that.
Yeah.
Research is a pathway towards that.
Absolutely.
Research for the sake of research. We are very fond of saying that I have 100 papers, 200 papers, or whatever that number is. But the real question is, how many papers have really helped the patients or the outcomes? That's why we use the terms implementation, research, and the change.
Change it has brought in, right?
So the change needs to come.
Yeah.
And change needs to come towards, I think, one thing, which is the ultimate, that is how do we serve the patient better? So for me, if there's no digital health for me, then hopefully, inshallah, I will find a way.
You'll find a way.
Obviously, I work in 3-4 areas, so that's
that's a beauty. That's the beauty. You can
so I can juggle and I can focus more. And as I said, in the last 4 years, I've focused more on healthcare leadership, because I think that's it's more effective. Even when I can help one person to change in my audience and create champions, I think that's the legacy, or the sadqa jariya, as we say, which will inshallah continue this movement, inshallah.
Right. Any messages for the young audience that we have today related to the expertise that you have in 4 main areas? So any messages you want to give to them?
Yeah, definitely.
Please,
definitely.
feel free.
And so I would urge, especially my younger physicians and healthcare professionals.
Yes.
So I always include nurses, pharmacists, healthcare professionals. All stakeholders are important.
Yeah.
I would urge that please develop a patient-centric approach. Remember that you became a nurse, you became a physician, you became a cardiologist to serve the patient. So that's something which needs to remain on the top of your mind. We need to create a patient-centric healthcare. So when I use that example of the first document, which which came out in 1999 by Institute of Medicine, in a couple of years, the Institute of Medicine came out with another document, and that is called the Crossing the Quality Chasm. And in that document, they gave the solution to the problem which they had identified a few years back. And that document actually mentioned patient-centeredness or patient-centric healthcare. And we use another term which is called empowered patients. So we need to make our patients empowered, and we need to focus as healthcare professionals in developing a healthcare system which is patient-centric or patient-focused. So my request to all of my younger physicians and nurses and healthcare professionals is that develop yourself, become a professor, become a consultant, become a specialist, but remember that you and I and all of us, we exist to serve the patient. Perform your duties, keeping in mind that we are going to work in a patient-centric environment as opposed to maybe a disease-centric or a healthcare professional-centric environment.
All right. Thank you very much for spending time out with us and sharing your thoughts with us today. Lot of new arena for me and for the audience. To the audience, today we had this episode of Digital Health and Research. We had the eminent expert with us in the field of digital health, health, and other technology. Dr. Zakiuddin Ahmed. You have also listened to him. Thank you again for joining us at the Science Capsule podcast. And stay tuned for another podcast. Thank you very much.
Thank you very much. I would also like to thank you for giving me the opportunity, your organization, Getz Pharma, which is also helping us in Health Research Advisory Board. I would like to thank the whole team which has put this together. I know it's a teamwork and a lot of effort has gone into making this happen. I think it's a brilliant idea, especially using technology and social media. So please accept my special thanks. And it would be really nice to use these such conversations to inspire our future leaders in healthcare. So I really appreciate it, and thank you again.
Thank you very much for being here, sir. Thank you.